Thank you, and thanks everyone for joining today. I'm indebted to Runsi, who continues to see the importance of this area that I'll be sharing with you today, integrative medicine and lifestyle, and how it's just so important to first and foremost keep us cancer-free, but those of us who have cancer to be able to survive, overcome, and ultimately thrive. I have slides to share because as an academic, that's what we do. We always have our props, so I will take you through a little bit of a journey in and around this whole area and be able to share some of my own personal insights. As you heard, a lot of what I'll be talking about in this brief 20 minutes is in this book that I wrote a number of years ago with my wife, Allison Jeffries, with really the focus of trying to synthesize all of this information that I'll touch on today that we hear in different parts of the world that oftentimes is contradictory, and we'll touch on that briefly in the area of diet that you're going to hear about in more detail from other speakers in this conference, and trying to just make it simple and cut through all of the hype and leave people with information that can be really useful. We are honored to have this published in a number of different languages. For those of you who know folks where English isn't their first language, Italian, Spanish, Portuguese, etc. The list goes on. And a very interesting thing happened on literally the day that we signed off on the final PDF, the final version, emailed it off to the publisher saying we're not going to make any more changes. Literally on that same day, I was diagnosed with an advanced melanoma. And so I all of a sudden went from the person writing this book on how to prevent cancer and how to thrive after a diagnosis of cancer, improving outcomes, to being on the other side of that exam table, so to speak, and having to start my own cancer journey very quickly because it was an aggressive cancer, and started neoadjuvant immunotherapy, then had surgery, and then a whole full year of treatment. I've now broken last month, 5-year mark. I can't even believe that it's already been 5 years. And in some sense, it seems like it never happened. And then in another sense, it just seemed like it was yesterday that I was getting my immunotherapy there in the hospital, which I actually appreciated the break and being able to leave my office and hang out with my wife for this extended period of time. So let's get into the mix of six, as we call it. I'm not going to have time to get into all of these areas today, but I'll highlight some of the most important ones for you. And then in the open discussion session, can get into more details on the ones that I wasn't able to get into or go deeper into some of these other topics. So you can see them listed there: social support, stress management, sleep, physical activity, diet, environmental toxins and exposures. And, we often hear a lot about physical activity and diet as a way to maintain our weight, and certain, superfoods that are going to keep us cancer-free and all the rest of it. And we tend to forget about these critically important other areas, in particular those first three. So we're going to spend a bit of time in the area of social support and stress management. That what's important to know, although we're not going to get into all the details, and you heard from the prior talk, the important biological processes that we in cancer medicine are trying to control, trying to get the cancer to stop disrupting our systems, because these cancer hallmarks, these biological processes that you see listed there, one or more of them needs to be activated to allow that original mutated cell that's happening to us all the time, to allow that original mutated cell to grow and thrive in the body. And if we can shut down these cancer hallmarks, then that mutated cell is going to proverbially wither on the vine. And that metaphor of vine is one of the cancer hallmarks, meaning inducing or accessing the vasculature, or something that's called angiogenesis. Cancer cells release proteins that allow the cancer to form its own vasculature. And this, of course, is important for the cancer to grow and thrive because it has lots of blood feeding it. And there are anti-angiogenic drugs that exist to be able to stop the cancer from doing that. Cancer, as we've learned, also releases proteins that allow it to avoid immune destruction. And immunotherapy is a treatment that helps to shut down that cancer hallmark so that the immune system recognizes the cancer as something that needs to be destroyed. So the mix of 6 influences a minimum of 1, and in some cases, as you'll hear, all of these cancer hallmarks. So it's not about exercising and managing stress to just feel better, although that is a very important outcome that we get from those interventions, but it impacts our biology. It impacts what's going on the inside. And as Allison talks about when we give presentations together, what we're feeling on the outside, feeling run down and blue and stressed, that actually has a reflection of what's going on biologically on the inside. So the key is to harness the mix of 6, make our body as inhospitable to cancer growth as possible, at the same time as, of course, thriving and feeling better. And if there's one thing I want you to leave with from this talk, it is this concept of synergy. So we in medicine will often look at, even in behavioral science, a lot of these areas you see pictured here, the mix of 6, in isolation. We study the effects of a Mediterranean diet. We study the effects of yoga or meditation on sleep and aspects of quality of life. There's a lot of interventions looking at how to improve individual sleep. But what we tend to not do is research these behavioral factors together. And what we know is that by just intervening on one of them, not only are we not going to get the benefit of some of the others, but we tend to shortchange that one thing that we are intervening on. So for example, if we're trying to have somebody lose weight and we just put them on a low-calorie, low-fat diet and have them exercise more, we're forgetting about the importance of stress management and sleep. We know that people who are chronically stressed have a change in metabolic processes, so the beneficial effect of that healthy meal is going to be diminished. And there's clinical trials that have actually shown that. We know that people who don't sleep enough have a change in metabolism, and people who are sleep deprived tend to have a higher propensity to keep weight on. So if you're trying to lose weight, but you're not getting a good night's sleep, it's going to be harder. So what we want to do is harness the positive synergy to be able to get the most out of that healthy meal by managing stress, sleeping well, exercising, etc. And it all starts with social support. Social support is the backbone on which all healthy behaviors need to take place. And there's what you could call a direct effect of social support and an indirect effect of social support, where we see actually a direct effect of social support in very elegant research that's been done over the past number of decades by my close colleague Susan Lukendorf out of the University of Iowa, who also works closely with Anil Sood, who's one of the gynecological oncologists at MD Anderson. And here we see, and she's replicated this in a number of studies, that ovarian cancer patients who have the greatest amount of social support, in particular being well emotionally attached to others, have better survival after a diagnosis. And she's even gone further and found that this concept of social support and and in this case, social well-being. The higher the social well-being, the lower this protein that stimulates angiogenesis, as I was mentioning earlier, the formation, allowing the tumor to form its own vascular system. High social support, the lower the ability of the tumor to form its own vasculature. So these are what you could call a more direct effect of social support, literally down, in this case, into the tumor microenvironment. And then the indirect of social support is where we need support to be successful in everything that we do, and certainly in engaging in healthy lifestyle, but in and around cancer, it's critically important. And you can see here and read in more detail in our book, how to set up a good social support network, the different kinds of social support. And suffice it to say, it doesn't all come from one person, and that's too much to expect from one person. So you look around your community and call on different people for the different kinds of social support, and look at your pillars and harness each one of them to ensure that they're as strong as possible. So then you can move into the other areas of the mix of 6. And next up is stress and stress management. This area is just so critically important because chronic stress will literally sabotage all our good intentions for healthy living. And we know that this release of stress hormones that we feel during stress is actually good in the short run. This acute stress response that allows you to mobilize your body, your energy to be able to succeed in a difficult task is good in the short run. But when that becomes chronic and unremitting, that's when there can be both psychological, behavioral, and when it comes to cancer, biological changes that we really don't want to have happening. Stress, we know, can literally get into the tumor microenvironment and make it more hospitable to cancer growth. You see an example here of a very important stress hormone, noradrenaline, the British term, norepinephrine is the American term, and it will essentially activate all the cancer hallmarks. And Anil Sood's very elegant research done in animals and then subsequent work done in humans, and specifically in ovarian cancer, shows that norepinephrine leads to faster tumor growth. And there's actually been some research looking at the use of beta blockers like propranolol as a way to block the effects of norepinephrine to be able to decrease the harms of excess sympathetic nervous system activation, whether that's due to chronic stress or some other biological processes going on in the body. Suffice it to say that chronic stress activates all the cancer hallmarks. So it's critical that we do something to help manage this. So this physician is saying to the patient, stress is killing you, you need an easier job, smaller house, different family. Those of you who have a family probably know that this would probably work to some degree, but not something that we can write out on a prescription pad. But there are a lot of things from the behavioral perspective that we know will have an impact on chronic stress. Some of these conventional in nature, cognitive behavioral therapy, group or individual types of psychotherapy, individual practices like guided imagery, etc. And then looking to our colleagues in the East, things that fall more into the area of integrative medicine, yoga, meditation, hypnosis, different forms of expressive art. Not only is there a lot of evidence to show that these types of interventions improve quality of life, decrease stress, improve aspects of mood, etc., but they have a biological impact. They will decrease norepinephrine and cortisol and improve cell-mediated immunity, a key component of our immune system to help control cancer, survey cancer. And it's not just about, again, impacting just these, what we'll call these more soft measures, there is evidence to suggest that it has an impact on our biology. And this is a fascinating study that I just came across a couple of months ago, even though it was published a number of years ago. Relatively small study, but what was very interesting about this study is that they took a relatively brief, 8-week program of mindfulness meditation, and wanted to look at not only how does this impact depression, anxiety, and aspects of quality of life, but did it have an impact on this more profound concept of eudaimonic well-being, that you are feeling more meaning and purpose in your life. And there is evidence that finding more meaning and purpose in life, of course, not only do you feel more enriched as a human being, but that actually has a biological impact. But most of that was done with correlational studies. Those who score high in eudaimonic well-being, high in meaning and purpose in life, not only had lower levels of depression and anxiety, but they also had decreased inflammation, increased immune function, all the way down, as you were hearing into the previous talk, down into how our genes behave in terms of gene expression profiles. So here they looked at young breast cancer patients, in this case, who did this 8-week mindfulness program, looked at depression, as well as pre and post changes in inflammatory gene profiles. And what they found was not only better depression and increase in eudaimonic well-being, but they found that the greater the increase in eudaimonic well-being, the greater the increase in particular of antiviral and antibody related of genes related to how those biological processes behave. So not only is there an improvement in quality of life, but of course in key biological processes to help keep us cancer-free. Exercise, we don't have to go into that much about exercise. The data is just overwhelming. Every physician needs to have an exercise prescription pad that they tailor to that individual patient. You can see here the list of a dozen or more cancers that are reduced if people exercise, decreasing the cancer risk. And there's clear evidence that patients who are exercising throughout treatment have better quality of life, they live longer, and this is true for multiple cancers, including ovarian cancer. And although it may seem somewhat contradictory, exercise actually counteracts cancer-related fatigue. And I had my own experience of cancer-related fatigue with immunotherapy. And, you know, I wondered at different points in my treatment, you know, if I was experiencing this cancer-related fatigue. But one day when I got home and was walking up the driveway, it literally felt like I had cement boots on, and was challenging just to put one foot in front of the other. And at first I thought there was something seriously wrong. And then the light bulb went off, and it's like, oh, this is cancer-related fatigue, where you feel like you can barely move. And then, of course, I remembered the prescription that I'd been sharing with patients over the decades, and said, well, I need to exercise, even though I feel like I can barely walk. So I got our very active dog and said, let's go for a walk, and, you know, just push myself to put one foot in front of the other. And halfway around the block, I started to feel a bit better. And I was able to make the walk around the block, and the fatigue didn't disappear, but it diminished. And so there is evidence to suggest that this contradictory concept that the more you're active, the less fatigue you'll feel, there is actually evidence for it. In addition to just being more active, we need to be less sedentary. And this was a fascinating study, a large cohort study done by a cardiologist at MD Anderson, Dr. Gilchrist, where they looked at total sedentary time, independent actually of physical activity. And the individuals who were the most sedentary had the highest probability of cancer-related mortality, both in terms of total sedentary time and in terms of mean bouts of sedentary time. And in some sense, those were independent. So how do you put this into something that we would understand? Well, they determined that if you replace 30 minutes of sedentary time with 30 minutes of moderate to vigorous physical activity, you'd lower your risk of cancer mortality by 31%. That's a pretty big number. And even light physical activity reduced cancer mortality by 8%. So the message is essentially to sit less and to move more. This was reinforced by a study you can see here, just published last year. And what was interesting here is that they looked at people who in different categories of sufficient, insufficiently active, and then really inactive. And there was still an effect of sitting time. So here, these individuals were totally inactive, but this group here that looks like the sufficiently active group, even though they were inactive, they just sat less than these individuals. They were only sitting 0 to 4 hours a day. So essentially just standing up and moving more, even though they weren't physically active. So even if you're inactive, you can decrease the risk of death if you simply sit less. When it comes to the cancer hallmarks, exercise, let's say, deactivates, has a positive influence on all the cancer hallmarks. And the prescription, again, is relatively simple. You see here from the ACS. More recently, they have said these guidelines that getting more than 300 minutes is going to give you the most health benefits. But essentially, being active for at least an hour a day and then just sitting less. And it doesn't have to be at one time. It can be spread out. Again, these different bouts of activity throughout the day. And not only are you deactivating all the cancer hallmarks, but you see here the benefits on other aspects of quality of life. So last but not least, the area of diet. Don't drink. It's that simple. Alcohol is a carcinogen. You want to have a little bit of alcohol here and there, that's okay. But alcohol is still a carcinogen, meaning a substance that will cause cancer. It is not a health beverage. Forget about the heart disease stuff. That's not something that is actually that meaningful, it turns out, over time. Who knows who funded that research? This is the most recent report from the American Association for Cancer Research. NCI has a statement now, ACS has a statement now to fully decrease risk of cancer when it comes to alcohol. There is no safe level. When it comes to what we know is healthful, it is consuming foods that are whole grain, whole food, fruits and vegetables, and data from dozens and dozens of studies over the decades can be reflected in this type of a graph, which is that you can add decades to your life, in this case, a decade to life expectancy by switching from a typical Western diet to one that includes more vegetables, whole grains, nuts, and less red and processed meats. This is data specifically relevant to ovarian cancer, looking at the quality of an individual's diet in survival after ovarian cancer. And the higher the diet quality associated with lower all-cause mortality after an ovarian cancer diagnosis. And this was particularly relevant for people who were in a healthier weight range, but maintaining a healthy weight, of course, is a key benefit for survival after a cancer diagnosis. This was a paper that was just published a month ago in JAMA Oncology, actually looking at the relationship in multiple cohorts of following a Mediterranean diet in response to immunotherapy. This, of course, being particularly relevant to me. And I believe that this data is going to be relevant to patients undergoing immunotherapy for any cancer. And the data just hasn't been collected, where you can see here, as the Mediterranean diet score went up, response to immunotherapy went up as well. Back to the cancer hallmarks, diet has an impact on all the cancer hallmarks. And in particular, we'll get into briefly discussing gut dysbiosis. So am I saying to you, as this line saying to the other, I'm trying to eat more vegetarians, am I saying you need to become a vegetarian? Not necessarily. And that's not certainly something that you need to do and that we advocate. But the majority of your plate, as you see pictured here, needs to be from the plant world. Ideally, half of it being produce. Fruits and vegetables are not substitutable. So we, in the typical American plate, we say 5 fruits and vegetables. They're not the same thing. Ideally, it's 5 vegetable, 2 fruit. The Japanese set this up in a very different way, and they're very clear. And they say 7 servings of vegetable and 2 of fruit. So as you can see here, the majority being produce, whole food, some fruit, whole grains, critically important, beans, wonderful source of fiber, and you hear about the importance of that, beans, nuts. And you can see there is some animal protein, and that is important, but have it be the minority of the protein that you get, and make sure that some protein is coming from the plant world as well. And avoid sugar and high glycemic loads food, and we can get into that more in the discussion. Just a couple more slides. I think there's an echo. I'm not sure why. Maybe I'm being pulled off the stage. This is a study we published just a year and a bit ago in the journal Science, showing that when we collected data from melanoma cancer patients, and I was actually one of the patients in the cohort as well as the PI of the human study, over time, at the start of treatment, we found that those who were consuming the highest fiber diet had the highest probability of responding to treatment. And interestingly, the patients who had the best response were those with high fiber diet and not taking a probiotic. And in fact, those who were taking a probiotic even decreased the beneficial effects of the high fiber diet that they were eating. So we're concerned that this supplement and probiotic supplement industry may be sending some misinformation to people. And we know that the best way to improve your diet is through whole food, plant-based diet. And this was a fascinating study in the last bit of science I'm going to show, where just in 2 weeks, exchanging African Americans who are eating a really unhealthy diet in Pittsburgh with the food that a South American rural African was eating, that was high fiber, plant-based, whole food, switching their diets for 2 weeks ended up showing that the African Americans had a decrease in the colon of this proliferation marker that is linked with colon cancer, and a decrease after just 2 weeks. And you see here in the poor South Africans that were eating McDonald's and fast food, they had an increase in markers that are indicators of risk for colon cancer. So this can happen fast, both for the benefits of a healthy diet as well as the harms of the unhealthy diet. And all the healthy prebiotic foods you see pictured here come from the plant world, and that's what will feed the microbiome and make your body as healthy as possible. And consume judiciously some of these probiotic foods that have healthy bacteria, but not too much, or else you're getting too much of a limited amount of bacteria. So just to close, here you see some summaries of what we're really striving for make sure that team is strong and supports you and is there to help you be successful. Engage in some type of mind-body practice. It doesn't need to be meditation, but meditation you can do anywhere. We have no excuse to not spend 10 minutes of quiet time focusing, doing deep diaphragmatic breathing, making sure you're getting the sweet spot you see pictured there between 7-9 hours of sleep, exercising, making sure that the majority of your food, the 90, is health supporting and not to be totally depriving. You can have maximum of 10% of your day being foods that may not be as healthy. Watch your environmental exposures and don't forget about that synergy. The more that we do, the more successful that we're going to be in each of these areas. And this is hard. This is a practice, and each day is a new time that you can start and to put your best step forward. The more you do, the better you get. So I encourage you to start anti-cancer living today and think about what your next step is. Thank you.